was September 2020 when I received a call that was going to change my life in many ways. This was just months after we had launched our women's media platform, a platform that my daughter, my best friend, and I had created together in the tough, bleak, and often solitary COVID times to build connection and also to share some real stories of optimism with the hope to empower women. The call was from a friend. I'm going to call her Smita for confidentiality reasons, a brilliant Asian American woman from the world of finance and consulting. She had also pursued her MBA, all this while working full-time and raising 2 young children. She said that she wanted to meet me for coffee because she had something very important to share with me. This was going to be one of the most meaningful and impactful meeting of my life. She shared with me that she had been diagnosed with stage 4 metastatic breast cancer, stage 4. She was young, only in her early 40s, an immigrant who had dedicated her life to making her American dream a reality by working extremely hard, making innumerable sacrifices. She had never paused. All her energy was dedicated to work and giving life structure and family, but most of it was structured around roadmaps and plans until one day when that scaffolding collapsed. She was terrified, vulnerable, yet incredibly brave. She told me that she wanted to share the story not just with me, but with the world. I was inspired, but I was also intrigued because in my job as a primary care physician who sees many South Asian patients, and of course I have many South Asian friends, cancer diagnosis is often kept very private. And there are many reasons for that. It could be fear, uncertainty, sometimes it is the cultural backgrounds, but most often I feel it's because people want to protect their family from any stress or anxiety, especially when they are so far away. So I asked her, why share and why now? She replied to me with her favorite quote by Morgan Harper Nichols. Tell the story of mountain you climbed. Tell the story of mountain you climbed. Your words could become a page in someone else's survival guide. At that time, I knew that this was not just a story. This was a spark. She wrote the story in her own words, and we published it on our platform. She wrote about the sequence of events as they had happened, about receiving the diagnosis in the week of Thanksgiving, when she found herself weeping uncontrollably at the dinner table. The holidays, which were time of joy and celebration, were overshadowed with fear and grief, as she had all these thoughts racing in her head. How was she going to manage the job that she had worked so hard for? Complicated treatments, but above all, would she be able to watch her 2 young children grow up? And I think all mothers know that our biggest nightmare is not being able to watch our children grow up. So she said that she wanted to inspire people so that maybe somewhere it could save lives and people would know what living with cancer is like rather than just survival stats. She slowly tapped into her inner strength and found her purpose by redefining life, not as a series of milestones, but as moments that needed to be lived fully. I was so inspired by her strength, her grace, and how she had taught me how to navigate the biggest storms of your life with courage and conviction and hope. We could not have anticipated the response that we had to her story. So many women wrote to us. Some went and got their mammograms. Some said they were able to share their story with their friends and family and got the help and support that they needed. As a doctor, I learned so much. I learned about the emotional toll of cancer. I also learned about misconceptions that women have. I also learned that there are so many factors which affect how women navigate healthcare. I was surprised to know that so many women don't get their mammograms because they think that breast cancer is a disease of older women or those with family history of breast cancer, whereas studies have shown that breast cancer is increasing in the younger women, especially Asian women, where it has gone up 10% in the last 10 years. There are also many other misconceptions, and there are also studies that have shown us that, for example, there is a study by the Radiological Society of North America, which has clearly shown that Asian women lag behind all American women in getting their mammograms done, 64% versus 72%. Now, these numbers may look very small to you, but it's also important for us to remember that we have to use every option to save every single life that we can. I also learned that women tend to prioritize the health of their family, health of their children, way above their own, especially when there is limitation of time. And so many women saw themselves in Smita, a busy working mom who told herself that she really didn't have time to get sick until the universe did not give her an option. We got so many messages after that. There were many women who wanted to share their story with the hope that it'll inspire someone. We shared another story which also impacted me deeply. This was another working woman with young children, a South Asian woman who was diagnosed with metastatic colon cancer. She wanted to emphasize about testing for colon cancer with early colonoscopies. This is again a test that people lag behind, especially women, whereas the numbers are going up multifold. And I was very impressed that so many women then went and got colonoscopies. This got us thinking in our Women Who Win team. We started thinking that what if all these steps that we could take, could they help bridge the gap? Could they compel any change? Would people change in their thinking? Because data, science, all of the information and stats are very important. But what people are looking for is community. People are looking for that connection. And when you share these relatable stories on a platform, it's not just informing people, it is motivating people to take action. It's motivating people to act. I had always believed in the power of storytelling. I always feel that everybody wants to be seen. Everybody wants to be heard. Everybody has a story to tell. And everyone also wants to be inspired. I was only 14 when I wrote my first story. And I wanted to be a journalist. But growing up in India in 80s, that was not a career option that was recommended for women, especially in some families like mine, whereas being a doctor was very much favored. So I chose that path. And I have to tell you, I love being a doctor. It has been an enormous privilege for me to take care of patients for many decades. Interestingly, I also found that patients have their own unique stories. There is a treasure trove of stories in medicine. And a few years ago, when I started volunteering in the community, I met so many doctors who had similar experiences, similar stories to share, especially the primary care physicians, because they were often anchors in the community that they served. Inspired by their stories, I wrote my first column for a local magazine called Movers and Shakers in Medicine. And I was so thrilled because this is the first time I was able to bring my two worlds together, my passion for media and storytelling, along with my insights and expertise as a doctor. And this led to creating many other platforms which brought our community together. The community really came together in many different ways after we launched these platforms. And I'm not the only one who believes in this. There's so many others. A person who inspires me deeply is Dr. Abraham Verghese. He's a renowned physician from the Stanford School of Medicine, who is also a master storyteller. And he has written many books and essays where he talks about the doctor-patient relationships and why is it important that doctors discover the soul of medicine. Because stories, when told with intention, are not just there to be heard. They are there so that there can be changes. It can promote policy change. It can inspire people to change their behavior. It can also change public opinion. So I leave you with this today. Is there any story that you have not shared yet? Is there any page that you can add to someone else's survival guide? Or more broadly, is there any passion that you have that you can bring to your job and make somebody else's life better? Because sometimes the most impactful thing that we can do in helping others in their climb is by sharing their stories on a good platform with love, empathy, and respect. Thank you.